Hi everybody, I'm Mrs. Close Long and I just wanted to have a quick chat with you about whether or not you might want to take child development as an option in Year 10. Now over the next few weeks you're going to start thinking about and deciding which options you would like to do. And a lot of the subjects that you're going to think about are going to be subjects that you've studied at Key Stage 3. But a few of them, like child development and like health and social care, are subjects that are completely new to you. And so I think it's really important that I get a chance just to have a chat with you about what those subjects entail. In child development, you learn about how children grow and develop from birth until the age of 5 years old. This includes their physical development, such as getting taller, learning to crawl, run and walk. And it also includes their cognitive development, such as how they learn to talk, how they learn to solve problems and so on. We also look at how children make friends and how they develop emotionally. As we study child development, we'll look at a range of factors that can affect how a child grows and develops, and these can affect a child positively and negatively. So for example, we might look at how exercise impacts on a child's development, or how having a good diet can make a difference to a child's growth and development. We also might look, for example, at the impact of a mother smoking while she's pregnant and consider how that will affect her child. The second part of the course looks at the importance of play and how play promotes a child's learning. We'll try and design some child-friendly play activities that will stimulate all aspects of learning. Now, it's really important that we understand that all children are different, so when we are planning play experiences, we need to make sure that the experience is accessible for all of the different children that we might be planning for. So we might need to think about making adaptations to support children who've got a physical or a sensory disability, or for some children who have additional learning needs. The first unit that we're going to study is Component 1. This unit looks specifically at children's growth and development. You'll learn about how children grow, develop and how they learn new skills, and you'll develop your knowledge of the typical patterns of growth and development for children of different ages. Now these are sometimes referred to as milestones, which is something you may have heard about. You'll find out about the roles of different professionals, including health professionals and early years practitioners, and you'll learn how they assess whether a child is meeting the expected patterns of development, and also how they can support children who are not doing so. You'll also develop lots of transferable skills, including skills in research and written communication, which will help you if you decide to carry on your studies at A-level, or level 3, or go on to university after that. In Component 2 we focus specifically on play, and you'll develop an understanding of how play activities can influence a child's learning between birth and the age of 5. You're going to consider all of the different types of play that children can engage in, and you'll think about how these activities can support children's learning and progress. And then what you're going to do is look at play activities that you can design and think about how those play activities will support the children that you are caring for. You might think about big activities that you can do in a nursery and smaller activities that you can do in the home. You're also going to understand all of the theory that underpins these activities and understand why these activities will help a child to learn and develop. This is a really important skill, and people who have these skills are really highly regarded within the early years and foundation stages of education. And it's basically essential for anyone wanting to work as an early years teacher, a nursery practitioner or a play therapist to be able to plan activities that are designed specifically around the children that they're looking after. In Component 3 we look at supporting children to play, learn and develop. Now every child is special and every child's unique, and every child's going to develop skills and knowledge at different speeds to other children. But we know that some children are affected by individual needs or circumstances which are going to affect how they learn and how they develop. This can include physical needs, such as children who've got an illness, a disability, children who are blind, children who might have hearing impairments, and it's also going to be children who've got cognitive and intellectual needs, such as children with a learning disability, children who have poor concentration levels. We're also going to have children that we look after who have English as an additional language, or children who might have social, emotional, behavioural needs, and these might make them have different needs to the majority of children that you care for or you look after. So in this unit, we investigate the role of the adult in making sure that all children are safe when they're engaging in play activities, and also investigating how activities can be adapted to make sure that every child can join in with the play. Every child gets an equal chance to learn, an equal chance to develop. It's okay not to know what you want to do in the future. And just because you take a child development course, it doesn't mean that you're going to definitely end up working with children in the future. But the course will give you lots of useful knowledge and skills that will help you in any role that involves working with children. So that can include working in social work, it can include education, it can include paediatric nursing, and lots of other jobs within the NHS. And you know what? Even if you don't end up working with children, lots of the things that you learn will help you in the future if you decide that you want to become a parent. And actually, if you've got little brothers and sisters at home, you can learn things that will help them to grow and develop effectively. Now I just want to tell you a little bit more about how the course is organised. There's basically 3 units, and I've told you a little bit about all 3 of those units already. But what's interesting about the BTEC Tech Award is that 2 of the units are assessed purely through controlled assessment. That means it's not an exam. So for component 1 and component 2, which together make up 60% of your final grade, you will actually do a piece of coursework. Now each of those pieces of coursework will be done in controlled conditions, so you won't be able to do them at home, you are going to have to do them in school. But if you are one of those people who really does not enjoy exams, then actually the controlled assessment might be something that will really benefit you. Component 3, however, is assessed through an exam, and that's worth only 40% of your final grade. In the end, what they do is they add up your marks for all 3 components and give you a grade based upon the total mark given. Once you've completed your qualification in child development, there are loads and loads of different career paths that you could take. You could go on to do a BTEC National Level 3 in Child Development, or you could go on to do your A-levels. You could take Health and Social Care at Level 3. There are a whole range of different courses that you could take. Once you've got your Level 3 qualifications, you've got lots and lots of different options. For example, teaching at any level, or actually specialising in early years teaching, working in a nursery. If you do some science and some health qualifications, you could go on to nursing, maybe paediatric nursing, which is specialising in children's nursing. You could do play therapy, care work, social work. You could work with children with special educational needs or speech and language needs. We've also got child psychology, occupational therapist. You could be a health visitor or a midwife. There are so many careers that this gives you a route into. So if you're interested in doing this course and you've got any questions, because I know it's a bit weird just listening to me talk over a PowerPoint, so if you've got any questions at all, please come and see me in school. I'm in B09 these days, which is the old isolation room, or you could email me on jclong@davidneeper.academy.